Hello, listeners. Welcome to Views on Health. Back with me on the program is Dr. Charani Anuradha Abeyweera, Senior Registrar in Adult Psychiatry at the National Institute of Mental Health in Sri Lanka. We had Dr. Charani Anuradha Abeyweera speak to us the last time around on the Mental Institute of Health per se, the National Institute of Mental Health per se, giving us an insight into how the institute works. Tonight we are focusing on the mental health well-being in times of crisis. Crisis not only Sri Lanka but the world over, but our focus of course is in Sri Lanka. And having said that by way of an introduction, can you tell us for a start, Doctor, whilst I welcome you to the program once again, to tell us what sort of crisis do you see as far as mental health is concerned?
Thank you. For the current times, I would say crises are several. We have several crises. One would be the COVID. It started there. Then prior to that, there was the Easter bombings. And even prior to that, we had the war. Civil war, which has ended in 2009. For a period of time we have had a placid time, and then after that again the Easter bombings, the COVID lockdowns, and most recently our economic crisis in the country. So these would be the major crises we see as a society in Sri Lanka. In addition to that, there are individual and interpersonal crises as well. So all of this can lead to mental a disruption in the mental health well-being of a person. And even globally, we see the economic crisis, we see the COVID lockdowns that are happening, and there's monkeypox now, restrictions to travel. All of those are individually and at a societal level, they are crises.
And obviously all these impact on man. And in Sri Lanka, how bad is it?
In Sri Lanka, I would say it is pretty bad, because we have not had the basic infrastructure maybe, or the medical or societal attitudes, or how to say, preparedness. Our mental health preparedness is not very good. So because of that, the way we react to crisis individually is different from person to person, from society to society, from place to place. And also during our work periods, we have different challenges. With this ongoing crisis and economic disruption, how do a person live and keep their mental health well-being? That would be very important and very difficult during these times.
So could you advise us how best one can keep one's mental health in check?
Okay, so initially we have to know what kind of stressors we have. For that, we have to be aware of our own setup, like our own mental health well-being. What is mental health well-being? So it is one component of the WHO definition for health. In addition to the physical and other society, the religious and spiritual well-being, mental health is also one part. It's very important because with this we interact with the other physical, the economic, the interpersonal, and also other social, and even the economy can be threatened if a person or the society is not in good mental health. So to understand that, we have to understand whether we are stressed, anxious or depressed, and how are we going to handle that. Do we have a good coping mechanism? Do we have good support system? And if not, how am I going to get that support system? How am I going to create it at this moment in time where I have not created it before? And who is there to help me? Who is there to listen to me? Will I be judged? There's a lot of stigma regarding psychiatric illnesses, and even stress, anxiety, depression, which are very common, can be very disrupting to a person, as well as not accepted because of the stigma. Because of that, we have, as a psychiatric body, So we have the NIMH, the National Institute of Mental Health. We have the Mental Health Directorate in the Health Ministry. So along with them, and also our Sri Lanka College of Psychiatrists, we have made several helplines. So the one we use most, national level helpline, is 1926. So 1926 is the first year of our institution, establishment of our institution. So that is the year. So it's easy, 1926, and that is the helpline. It's a 24-hour hotline. We have stations now in outstation as well. First it was only in IMH, but now it has gone up to Kandy. We are trying to decentralize it, so it will be national. And we have area-based nurses who are handling these issues, and we refer them to relevant areas or doctors. So what we do address mainly would be anxiety, stress, as I said, depression, and also gender-based violence, child violence, abuse, things like that all come into this helpline, the hotline. We get calls 24 hours of the day. There are senior registrars, doctors and nurses who are allocated during these times. So we go on a shift basis, and we take each and every case seriously. We do get prank calls. I'm not saying no, but even that, initially we take it very seriously, and if we see it's a prank call, we will handle it as such. But if it is a very serious threat, for example, we have a lot of recent times, we got a lot of suicidal attempts. And even if a person thinks about suicide or harming themselves, it is good to call someone. If you don't have a friend or a colleague or someone close to you who you can tell your problems to, call us. 1926 is our health hotline, and we have the college hotline as well. So those are available. They're 24 hours on, and we do try to help them to get over whatever problem they have. We try to help them to solve problems in this crisis. So currently the most common crisis is the economic crisis. And because of that, how is a person able to handle their emotions and the children's emotions, and the children are not going to school. There is a huge deficit in the income, and they are not able to live their lifestyle the way they used to live. Issues like that crop up. There can all be factors that would precipitate depression and suicide or self-harm. So that is very important, that you understand that there is someone to help you. And our hospital is geared to be non-judgmental. Even if you tell a work colleague or a friend, sometimes they may judge. But we are not like that. We are trained professionals in psychiatry and psychology, and we do help them out as much. That is from the institutional and professional side. If we take individually, how am I to, or how are you going to keep your mental health well-being? So that is being mindful, like I said, being aware of your problems, trying to problem solve, if not get help, and also to look at things in a broader view, not just taking one aspect of there are several aspects, and we may be thinking about one problem too much, maybe 40% of the time or 60% of the time. That would be very difficult to handle. So if we understand that, and then be mindful about it and try to solve that problem. It may be an interpersonal conflict, maybe a gender-based violence conflict, maybe an issue with a child or work colleague. So how are we going to handle that? Those things are taught or educated with the social learning. If it's not so, we can actually help them. We can go with psychotherapy methods and help out to clear these doubts and conflicts.
Thank you, Doctor. Now, when you talk of something like anxiety, just on the other side, you say gender-based violence.
Yes.
That is something mostly, so it's physical mostly, most of the time. It could be emotional and mental also.
Yes.
One can harass a person mentally.
Yes.
You don't have to touch that person or physically harm that person, but it keeps saying things to upset that person. I mean, to actually make that person feel that, this is what you are. What I'm saying is what you are.
Yes.
It's not what you think you are, what you are. But I'm saying is what you are. That sort of is bullying kind of thing.
Yes.
All that. So now anxiety. can come from all of this if it's not brought out. Now, if you say gender-based violence and you find that, sorry to bring this in this way, but say the wife is being abused by the husband.
Yeah.
The men listening out there, it's not personal as far as you're concerned, but it's just, citing a way of bringing this as against anxiety. So then a wife can call and say, my husband is abusing me physically. And so maybe you then counsel them and try to solve that problem. But anxiety is something you go with by yourself within you.
Yes.
So that can be eating into a person for a while before the person will actually come out with it and say, look, I'm having this problem, or somebody else will notice it and come out with it.
Yes.
How does that come out actually?
Yes, first I'd like to clarify some facts. So you said bullying, and what you were saying was actually verbal abuse. So abuse has several aspects: physical, emotional, financial, psychological, and verbal. So all of those are incorporated, but we usually see the physical abuse, as you said correctly. That is what we usually come out with. That is what is seen, the harm to the body. And the other thing is, though it is the husband who is assaulting the wife commonly, so if I get statistics, about 253 women have come out in 2020 statistics with gender-based violence, but another 153 males also came. So altogether we have around 500 patients at the moment, both male, both female. Yes, it is more of a female preponderance. That is because of the social cultural aspect, but we do see males. So the males out there need not be harmed emotionally.
Nobody can be harmed,
yes,
male or female.
Female, yes.
Definitely not.
So, yes. So, but it is very good that you took it up. So that is a very obvious way of coming out with a problem. But anxious person will not come out with it unless they are actually in stress, distress, and they are not able to work or function socially. They will have a functional impairment as well. They may not be able to do their work properly or schooling properly. So an anxious person, actually anxiety is also a normal phenomena in our physiology. It is part of the flight and fight response of the body. So it comes out with when we are at a threat, a physical or physiological or even psychological stress, we are ready, geared through evolution to either fight or flight. That means to run away. So that is where the anxiety model comes in. And a person who is constantly anxious, who is always anxious, will have this dilemma whether to fight or fly every time. So that is when they become very distressed. They will get sweating of the palms, and tremors over the orofacial area, that is the mouth and the face, and they may not be able to speak. They will stutter. They will become socially, they will avoid social situations because of this anxiety, and they may not be able to perform well in whatever they perform, usually their work or home activities, and it is distressing. So yes, the individual does understand it by themselves. They try to handle it by themselves, try to calm themselves down using spiritual activities, using other distraction methods, and also using very maladaptive methods such as alcohol or any other substance misuse, which we see very commonly. And if not, they come to us as a psychiatric doctor, or even a GP, a general practitioner, or to a friend. And they will be either advised against or for whatever the reasons they have. And in our aspect, we take it as a neurotic disorder, not a very major psychiatric illness. So you don't have to get admitted. But if you're harming yourself due to this anxiety, if you're not able to perform properly, if you're going into a depression and you're trying to kill yourself or commit suicide or harm yourself by cutting yourself or using any other substance, as substance I would say alcohol, cigarette, nicotine, and also cocaine, opioids, cannabis, anything like that. So if it is used to reduce the anxiety or to reduce your the impairment, then it is a maladaptive coping method. So what we try to do is to get the patient or the person to have a adaptive coping mechanism, using it in a lifestyle and getting help, being non-judgmental, being aware of your own feelings and emotions and the situations, be mindful. And also we have methods of cognitive behavior therapy and psychotherapy that can be used. And on rare occasions, we do give psychiatric medication to combat anxiety. We can give a short course of some medications for a short period if they are having a we'll say they have to sing on stage, or there is a presentation that they have to go through and it is tomorrow and the patient or person came today. I have no time to do the psychotherapy. It takes time, about at least 8 sessions, so that's not enough time. Then I would administer a short course of medication. Or else if I see that the individual is having depression, then I would go for antidepressants. If I see that there are conflicts in the family, I would address that. If there's something major, a major psychiatric illness or psychotic illness, then that would be addressed. But those are very rare. Usually anxiety is part of our lives, and at one level of anxiety is good for performance. Only when it crosses that level is when it's detrimental.
How would you describe a panic attack?
Okay. A panic attack is where a person has a very severe anxiety kind of an attack, where you feel that you cannot breathe. Everything maybe, the sounds may be heard very loudly, your breathing may be shallow and frequent, and also you will have tremors of your hands, you'll have extra sweating, you'll have the feeling of dying, the fear of death. That is the major component of a panic attack. Other situational things may differ. So it could be that a person is in a bus and not able to get out, they get a panic attack there. Or they have a performance tomorrow, or they have a presentation tomorrow or today even in the next 5 minutes, and they're not able to get on stage. And then they will think that they're going to die. So they will hyperventilate. Hyperventilation is where you breathe very rapidly, very shallowly, and it takes out all the carbon dioxide and oxygen. So then you feel a chest tightening as if you're going to die. But actually in reality it's not so. So we have to calm down that person. We have to talk to the person, be be empathetic, talk to them and calm them down.
Thank you, doctor. There's a question that a lot of people talk about, panic attack, and so had it, or so was saying he had it or she had it, and not very sure about where it comes from and how it goes. So it subsides after that.
Statistically, if we find that a person is having anxiety or a panic attack, 20 to 40 minutes is the maximum. But you can, by overthinking, by re-giving the precipitating or triggering factor again and again, it can be prolonged. So that is where the danger is, where they may harm themselves. It may disrupt whatever they are doing at that time.
Thank you, doctor. And so just focusing on the mental health well-being in the time of crisis,
Yes.
Which is a time of crisis for everyone. Now, if you, when people come to you and you advise them what to do, maybe you put them on medication if need be. Is it something now, if it's pertaining to a particular crisis and that crisis is addressed, then that goes off, is it?
Commonly, yes. Yes. So now these crises that I mentioned previously, it happens to all of us, the whole society. So not everybody in that crisis comes to us. That is where the resilience factor comes in. So there are several factors. Just because there are lots of crises, just because there are a lot of individual factors, doesn't mean a person will become anxious or depressed or commit suicide or become aggressive even. It doesn't happen. So there is this factor called resilience, where some individuals are very resilient. It comes through their upbringing from the childhood, the way they cope, their coping mechanism, the support system, those things. And a person who is not able to handle the situation is the one who would break down, and the resilience will reduce. But that doesn't mean that all of us are out of this, because it could happen to me even tomorrow. I have no control of it, but I have to be aware that it would be happening. If so, I would seek care.
Now, if you take the economic aspect currently that, Sri Lanka is sort of faced with, and it has impacted on people. So now, would it be from our thinking as a lay person, A doesn't have money to feed the family, so B provides that money. Then, and let's say B say, okay, for the next 6 months, I'll take care of your family. Magnanimous B. So will that then solve A's crisis?
It won't solve A's crisis in the long term. The further thing is, B may get into a crisis himself within the next 6 months. Then what is going to happen? So that is where the problem solving comes in. Even financial issues and the economic crisis, we can actually regulate. We do time management, anger management, financial crisis management. We address those in our psychotherapy sessions or in our meetings with the clients or patients. So then we can come up with problem solving methods. What am I going to do? Am I in debt? Is this over my head? How am I going to handle it over the next 6 months? Things like that.
Back again, doctor, like every situation, it is an individual situation.
Yes.
And it has to be addressed accordingly,
Yes.
according to the needs of that particular crisis that a person is facing.
Yes.
But if there are multiple crises,
that is where the danger is. That is where they could precipitate into a major depressive episode, where they may feel there's no way out, and the only way out is leaving this world. So that would be suicide. Or we have had very sad stories where the father or the mother has found no way out of this, has had depression ongoing, and has tried to kill the kids as well as themselves. So we call that mercy killing. If they are left without me, they won't have a life. So I'll take them with me. And first the kids are attempted to be killed, and then the individual. So that happens. We have had a couple of episodes of that over the past 6 or 7 months. And also during COVID times, we did have that. That is because lots of the livelihoods have been stopped. They are not able to work, and they are working from home means it is not very consistent sometimes. Business people, like if they're having very small, like we'll say it's a small or medium business, so then if it has dropped over the past few years, it's going to be a real financial crisis for that family, and that would affect them all: the children's education, the food, the lodging, their well-being, their lifestyle. So that's a very big problem actually.
So doctor, we are sort of still going to be in this situation for some time, and hopefully before we can come out of it. So we have to face it.
Yes.
There's no running away.
No.
I mean, that's not the way it goes. No. However tough it is, we have to face the situation. So what sort of, I don't know whether it can be general advice, but what can you share with our listeners that will help them to address maybe their problem, or a neighbor's problem, a family person's, a friend's problem?
So one thing is that they can... We had a very cohesive lifestyle in the earlier times. With this urbanization and coming to the town area, to the city, and to work, and becoming more nuclear related family backgrounds, because of that our reach, the social reach, is very small now. So if we take for example a village, far out village, everybody would pitch in. If we see someone is destitute at that time, or in a financial crisis or any sort of a crisis, the whole village will come up, and that is how it was. Now it is not that. So what we should be aware is not to individualize ourselves, not to isolate ourselves from the society. Have a nice group of support, either families, either neighbors, your relatives, or your professional body wherever you're working, and talk, communicate with each other. Everybody is under the same stress. If we talk these days, commonly, if we start with how are you, and then the next thing is how was the fuel crisis? Did you get fuel yesterday? Are you able to feed your kids? Things like that are common these days. So talk about it. Ventilate your problems. Be mindful of your own issues at home and within yourself. And also to manage this, time management, spending long time in the queues for fuel, for food, for gas, it's detrimental. And also the attachment with the children, attachment within the family, those are, but we did see some good aspects also where people came together, they helped each other. So I have seen some people giving out tea and biscuits for the people in the fuel line. That is good. So that is way of making interactions and societally attaching ourselves with each other. So that gives a support system. Then we have a crisis, we have a support system. In addition to that, seeking professional advice if it's needed. And also the others who are around us should be vigilant of each other. So if I am, for example, if I am going down the depressive line and I don't see it, if one of my friends or colleagues or my relatives come up to me and say, do you have a problem? Can we talk about it? I should be able to talk to them. Not to think it is a criticism, not at this time. And people should not judge or criticize others at this time, because we are all going through this problem. We are all having it. The way we act out or project our problems out into the world is different. The way we feel it is different. The intensity is different. For one person it may be mild, for another person it will be very severe. So knowing that, being empathetic and like reaching out, being very cohesive with each other is one aspect, very important aspect. What I'm trying to say is not everything is a psychiatric illness. So it could be a collective effort that we could help each other. Yes.
So that's the bottom line.
That is, yes.
Thank you, Doctor. We end this interesting discussion on mental health well-being in times of crisis, as articulated by Dr. Charani Anuradha Abeyweera on the program today. Thank you so much to you, Doctor, for sparing a valuable time to discuss this important aspect with us.
Thank you very much.
Thank you to Indika Nishanta for technical assistance. I'm Fatima Razik Khader saying good night and looking forward to your company next Monday, same time on Views on Health.